And we're live.
Yes, we are. And we're back.
Yahoo! It's been
Clap,
definitely a
clap,
minute.
It's been a journey. Hey guys, I'm Sheila.
And I'm Ruel.
And welcome to
The CommoNurse
Podcast. And we missed you all. And to all our common nurses there, or our listeners out there, welcome back to our channel and our podcast. I'm not sure if you guys are updated. Hopefully you are. We are now in Queensland and it's been a month.
It's been a month since we left Canberra.
Exactly. And
Can you believe it?
It's been a while since we've done this one. We're just so busy unpacking. Roel's been busy fiddling around. And look at the new setup, guys. Can you give Roel a big shout out and a big clap right there? Ang galing. He's so good. So he organized the home office. We had to move a lot of we have to move twice, right?
Yeah. Because we can't figure out as to which room we're going to make an office.
Exactly. But yeah, welcome to our house, guys, and welcome to the new home office. We're probably going to do a tour. Not sure if they're...
Not in this channel, though.
Not in this channel, of course. On my channel, on my YouTube. So please subscribe, guys. Follow us on our socials. But tonight, before we discuss about or probably try to tell you about our experience when it comes to the move, tonight it's gonna be a different topic. So
Yeah. Something fresh.
something fresh out of the box, because yesterday was basically our first shift as nurses here in Queensland, and and we worked as agency nurses. So, Nako, do you want to tell our listeners what agency nursing is?
So they were basically hired by a company, and they're the ones who are getting in contact with the hospitals
Yeah. So,
anywhere in Queensland, basically.
yeah, not anywhere in Queensland, anywhere in Australia.
Yeah, anywhere in Australia.
So they basically the person or the company you talk to, if you're like short staff with comes to nurses, ENs. So agency nursing, basically you're just a pool of nurses where you were put where you are needed.
Yeah.
Yeah.
You're basically getting sent anywhere
Yeah, everywhere.
that's in need of a
Yeah.
staff member.
So in saying that, Nako, like, what were your prior thoughts when we were told, like, hey, you're going to go to this specific hospital and you're going to work in different sections of the hospital? What are your thoughts? Were you anxious?
Oh, definitely. Because I haven't been working in an actual hospital
Yeah.
for the last 6 years.
True.
But don't get me wrong, I did some agency shifts at the hospital back then before I was doing my previous job.
Yep.
But it wasn't a pleasant experience, only because you're not used to how they do things, because obviously you don't work there regularly.
Yep.
So you'll have to fiddle around and figure out how they do things.
Yep.
Which is sometimes very uncomfortable, because you will feel helpless and you will feel
And very
stupid.
unhelpful.
Yeah, unhelpful.
Yeah.
Like everyone's running around busy, trying to figure out how they're gonna finish the job. While you're there standing, like you're trying to help out, you're offering help, but because like you don't have your regular staff member pass to open medications room, like you're at the mercy of your buddy,
Yeah.
technically.
Yeah. And you always like try to reach out for help. Like, hey, I'm so confused. Where is everything? If you
No,
can
that's-
just guide me
That's
through
why,
it.
like, my hats off to those full-time agency nurses.
Exactly.
Yeah.
You guys are amazing. I don't know how you do it, but this is our first time back and first shift in Queensland. And again, like your emotions like towards the before we start our shift is like you're anxious. What are the things that are going through your mind? Like on our drive on the way to work.
I was probably just having the mindset that you can do this. You just figure it out. Just
Yeah.
try to be very helpful as much as you can. And just don't stand around and do nothing.
Exactly. I've expected worse, to be honest. Like I've expected to be put in a in a really busy environment that I had to, like step up and not to act like an agency nurse. Like of course, guys, we are talking about this experience of ours, but on the background of a long clinical and non-clinical experience nursing wise. So
Mine is clinical too. It's just
yeah,
it's not
yeah.
an acute setting.
yeah, exactly. So I mean, it's clinical and acute and non-acute setting, but it's like, you're always gonna be in that situation because this is what our job is as agency nurses. You're put on different situations, and that's why I was like keeping my mindset like, okay, we're gonna be busy. I'm gonna be pushed around, and I'm gonna be
Yeah.
told what to do and all that sorts. But I tried my best to participate and cooperate as a member of the team, and not just like an agency, like filling in the short staff list.
Yeah, it felt weird to begin with, like at the start of the shift, because like I didn't know how the routine worked. Like they were just giving me handover without orientating me as to where to get meds from, like how to do meds, where the charts are.
Yep.
So yeah, coming from ACT where everything has been electronic for the last 2
Yeah,
years,
it's
it
been
was
digital.
quite
Yeah.
primitive to go back to paper charts, especially just not one but two, like
Yep.
one folder that hangs on the wall again, and then another one that sits back at the station.
Yep. True. And mentioning that, guys, we miss you, Canberra. the
In that aspect, yes, we did miss you, Canberra.
It's like the convenience of the digital system that we use in the hospital or in Royal's workplace. Is that DHR is really quite like
Very
organized.
intuitive, yeah.
Organized and compounded in a way that it suits each department.
Yeah.
Because it's
Plus it's just
departmentalized.
one whole- yeah.
It's not like, hey, I can use your system, but we can't.
Plus, if you want to look for something, you can
Yep.
just type in the search bar, then it'll come up.
Exactly.
That information will come up. And like in there, like I was just struck. No one even orientated me as to what their med chart would look like as
Yep.
compared to how it was in Canberra. It's kind of similar.
It is similar.
Yeah, it is similar.
The only thing that I noticed is that the logo.
Yeah.
The logo. Basically everything's like similar. If you guys have been
Med charts, the
Yep.
actual medication chart is the same. The OBS chart, some minor variations, but it's kind of the same.
kind of the same. The pain score is actually at the back.
Yep. Yeah.
But the thing is, if you guys are educated here in Australia, you would understand what we mean. But basically, those kind of stuff. What did you find out that the most challenging for you, like from yesterday's experience?
Just for me, it's getting reintroduced to doing IV medications. Really. Yeah.
Yeah.
I look pretty dumb to start with. Like there was a lot of 4 o'clock in the afternoon IV ABs that were due, and then the nurse, my buddy, was just telling, "Oh, can you prep that one? Prep this one, and then we'll do it later." I was like, "Okay, so where can I get this? Where can I get that? Do you have the book, the IV book?" I was like, "Oh, have you never worked at the hospital before?" I was like, "Never in this hospital. It's my first. It's my first agency shift here in Queensland." It's like she was looking at me like as if I was dumb. It's like, I'm not dumb. Just tell me where to get stuff and I'll figure it out.
Yeah. But the thing is, good on you for asking that because it's also for your safety.
Exactly.
It's not like, we are busy. Yes, we're rushing into things, but we don't ever skip preparations, especially for those like new medications that you're not used of, and like have a read through it. Like sometimes it's pretty straightforward once you get into that IV. What was the Australian prescribed
injectable drug
injectables?
handbook
Yes.
or something.
The handbook. Yeah, just read through it. It will just straightforward tell you like this is, you can dilute it in 10 mils.
But it doesn't really help where she's
rushing you.
She's rushing you. At the same time, you see her prepping 3 different medications, and you're there reading, trying to figure out what to do with this one.
Yep.
It's like, just give me a minute. We just started the shift. Like, and The hard part with that one is she's doing a 12-hour shift, and most of the patients on our wing were full nursing care because they were confused, bedridden, a lot of false risks, or a lot who had recent falls. So,
Yep.
yeah, she was probably really burned out already for the first
I guess so.
6 hours of her shift, maybe.
And on top of that, she feels like she's gonna babysit you because you're an agency nurse. And
Yeah,
like,
but
you don't
she didn't
know.
have to. But
Exactly,
she
yeah.
probably just had too much high expectation. Was like, was it very wrong to tell her like, it's my first shift ever here in Queens? I was like, have you never worked elsewhere? I was like, it should be the same. It's like, no, it's not the same.
I guess like from your perspective, it is like because you haven't worked in an acute setting,
Yeah.
it's really hard to kind of adjust. But in my experience, like yesterday's was like a refresher for my ward experience. But then I think it helps that I work in ED, so you get to prioritize. And one good thing was like yesterday, my partner was she's very friendly. She's very like, she looks after,
Accommodating.
accommodating, and she looks after me really well.
Well, that's good.
And then we do team nursing, so she's not like leaving me in the hang and dry, and like she would tell me like, hey, let's do obs, and then probably like see your patients, da da da. But one thing that I didn't like about it, since like my experience is ED, and I always want to document everything, and it's like digital wise, like you can just bring your computer and then type down anything, because it's like they split the progress notes and the med charts, right? I'm like,
med chart and
this
obs
is
chart.
we're back to this again. So I'm like, okay, but I'm
And sometimes I was doing obs and I can't find where the obs chart is.
Yep.
And so what I've been doing is just writing it on my handover sheet, and then whenever the
Yeah.
chart pops up, then that's the time that I'll be writing
But
it.
that's the thing, because I don't like the fact that I can't really remember everything that what I did in that shift. I can, like, if in court, like, simba ko lang. If in court, like, I had to defend myself, then probably like my signature giving medications and all that, I could defend that one. But like progress notes wise, I can't. But like when we're doing that in the DHR, it's like pretty straightforward. Like you can just type in what an update that you've did to your patient. So that one I was like struggling, but because I'm also like trying to organize, and I'm like quick because like my ED background. So I'm like trying to get on top of the medications, get on top of me doing the progress notes. But apparently they do the progress notes at the last part of the shift when they're about to go home.
That's how
I'm
we've
like,
been doing it though in the Philippines.
yeah,
and-
I understand. But then again, like my training as an ED nurse, you can never go wrong if you put a lot of notes in there. Like because I don't think you can remember everything now. Can you remember if they ate all this, if they opened their
definitely
bowel? It's that. Well, that's what I struggled.
Yeah.
But but like to be honest, very. I would like to give a thumbs up to my partner last night. She was really good. She's on top of everything, every medication. I feel like I'm just shadowing and like supporting her and really helping her out technically, because I can't do like the pick lines and all that sorts. So she's done all the hard work.
Yeah.
But one good thing is that like from my end, like I've got everything organized before that it's the time to go home. So by the time it's time to go home, like I'll hand over my patient and then like I'll leave. Because that's how I'm trained. Like, you've got these things organized in your head. But then she's so good. She's handed over everyone. So I'm like,
It's just so funny because there was a moment yesterday that my pride just kicked in. She's like, "Do you know how to?" She asked me, "Do you know how to use the IV pump?" I was like, "I've never seen that kind of pump before because we use a different pump back in ACT. But don't worry, I know how to use it. I'll figure it out."
good on you.
It's the machine is very self-explanatory though. Like you have to pick whatever you're giving, so it'll calculate itself. So it's okay.
Yep. And the thing is, like, again, this goes back to our experience, both clinical and in acute or subacute, anywhere else. Like you can still remember your experience and your training.
Yeah.
But then again, it's totally different But like,
It's
you
a total
know,
different environment.
yeah. I understand what you mean. But I guess like, you know, because sometimes they're like rushing into things. They're very task oriented, which
Yeah.
is totally different from ED because we prioritize. You prioritize
Yeah.
which is your deteriorating patient and which is not.
Yeah.
So I'm like, but then again, I did really well yesterday, I would say, even though I had a fall, which is not my intent, like, you know, to begin with, but it happened. So, yeah.
And you
What
got
else can
abused by the
what?
doctor.
Well, yeah, but then look, she's she's small, I'm taller, so I don't care. Look, guys, I'm not saying that you should be like I did not like give her an attitude. She was giving us an attitude. She was giving all of us an attitude, to be honest. It's not like me. But then she was saying that, hey, keep that nurse in there. Like, make sure she just explains everything to me. Like, yeah, I'm here. Okay. I've seen
I'm not
worse.
gonna run away.
I'm not
from
gonna run
it.
away. I've seen worse, and I've dealt with a lot of rude doctors. So you're not the first one. So yeah, like I was telling the team leader and the other nurse, I'm like, she doesn't face me. Like the thing is, guys, like I know we have to be kind to everyone, but also be firm and know that you are not gonna be pushed over by anyone, even though they're doctors or like whoever senior staff they are. As long as you're not doing anything wrong, like falls are not your fault. It happens. It is a big incident, especially if they're on blood thinners, they're on this and they're on that. But if there's not a lot of harm, because I did also my like while I was with a patient, I was also doing my assessment. There's no bruising or anything. There's no blood. There's no bleeding. He's conversing with me. No loss of consciousness. Like, hey, I'm relaxed. I've seen worse, and you've seen worse in ED in the Philippines. So it's like, yeah, you'd understand what I mean once you're like back on track with like clinical stuff.
It's just a bit frustrating though, because at the very first part of the shift when we receive handover, we go back again to this paper form filled with abbreviation
That you
No-
don't understand.
that you don't understand because it's not internationally recognized. It's not the standard one that you follow.
Yep.
And they expect you to recognize all this in a snap of a finger.
Yep.
And then the one who's giving handover to you saying, oh, I don't know why it's in there. I don't know why he does have two cannulas. I don't know. It's like, so what do you know then? What can you tell me that I need to take down? Because you're telling me information that is already there in the handover sheet, but then you're adding stuffs that you're telling me you don't know why they're there. I was like, it doesn't make sense. So
It doesn't. It's like I feel like he just showed up for the shift and he's not ready to know anything. Like what do you know about your patient?
I was there ready to absorb a lot of things, but I was put in a situation where the ward was very chaotic or busy at that shift, where the regular staff just didn't have the patience or the spare time to
Explain things to you.
like they didn't have to sit me down. They just have to briefly walk me through how they do things.
Exactly.
So like most of the shift, like I had to figure things out.
Yep.
Like they have this time-based, hour-based planner
Yep.
for the shift that they follow as to what they need to do, meds at this time, obs at this time. So at least with that, I was trying to help out as much as I can without them telling me to do this, do that.
Yep.
And then one time, because my buddy had like 3 admissions or 4 admissions at the ward, and she was asking, oh, can you receive an admission? It's like, do you think I can receive an admission? I was like, I want to, as long as you sit with me and tell me how to
Do things.
do your paperwork. I was like, oh, no, because I have to register him or her in the system
Exactly.
for us to do. It's like, okay,
So-
you do that bit. I'll help out with the other stuff so that
Yep.
I can be more functional.
I think that was the best thing to do because like technically she'll be more effective and efficient doing that
Yeah.
rather than you.
Yeah.
And like you can be doing the task rather than her.
I was like,
So-
I'll answer call bells, do meds, do obs, whatever. Just do what you have to do. It's like, and just don't give me that look. Because if I was working there as a regular staff and know how things would work, like
Yep.
it would be a completely different story.
It
But
is.
anyway,
But look, I think we're nearing our or actually more
yeah.
than but
close
it's
to
like
20
we're carried
minutes.
away with
Yeah.
the emotions that we have. But then again, okay, last two questions. Not really questions, but how would you rate your experience from yesterday? Just so we won't scare our listeners, guys. Roel's gonna rate his experience from yesterday.
In what way? Rate
Like rate
in
it from 0 to 10. 10 is the worst experience that you had.
it's
Would
definitely
say.
not the worst experience, but
Or say 10 is a great experience. Like, I don't know how you want to rate it.
probably a 5.
A 5. So it's like a so-so.
It was a good refresher.
Okay. Yeah.
At least in case they send me to a different hospital, maybe sometime next week, I'll have a better understanding as to
Yeah.
how their system work in here.
Exactly. Like for me, it's about an 8 because it's not as bad.
Yeah,
Like
good on
really,
you.
my partner was really really helpful, and I find that like I get on top of things really quickly, and from my end, I've finished everything before I left it, so I think
That's
I did a good job. But okay, the last bit is that what is your takeaway, or what can you advise our listeners, especially those who are like wanting, or like students or wanting to do agency nursing while they're like studying their career profession as a nurse?
I don't know. I don't know what's the translation to English with this term.
Sige daw, I'll try.
Pakapala lang talaga ng mukha, guys, pag kailangan mo ng pera.
All right, guys, you have to be thick-skinned when when you do agency nursing.
Were you in a dire situation and you need money,
Money.
that bad
That
because you
bad.
haven't had any income for like close to a month now,
Yeah.
and your savings are just going through the drain for all the bills that are still
Coming
coming in. You just have to suck it up.
Yeah. But the thing is like always ask questions, and if you're not sure, please do ask, because I'd rather have you guys be safe and your license be safe because you worked hard for that one, rather than be rushing into things and then making mistakes. And I've noticed a lot of mistakes that was done yesterday, so I don't want you to experience those. And personally, I don't want that to experience as well, because it's gonna be like in your paper, but last I think an advice as well for those nurses who's also doing being budded to an agency nurse. Please be kind, and also please make sure that you have the time, even just a spare 2 minutes, to orient your nurses to where everything is. That would really help us, because I feel like, we're just like, we're already frowning. We're already like negative.
Frowned upon.
Yeah, frowned upon. Especially when they know that like, hi, I'm gonna be partnered with a agency nurse, and they're like, this is gonna be a slow day. This is gonna be like, don't do that. Like, try to make use of them. Take advantage of you've got a spare person. Give them the task, because I think they're more effective that way. If they're not experienced, please teach them.
Yeah.
And always, guys, also for agency nurses or other nurses, don't say that I haven't done that. Just say this statement with me, guys. Okay, repeat after me. I haven't done it, but can you please show me, and I'll do it next time. Right?
Yeah, just don't say no straight away. You don't know how to do it.
Exactly.
But I haven't done it, but please teach me how to.
Yeah, because it's not you're not gonna learn about it if you don't try.
Yeah,
right.
definitely.
So yeah, that's our takeaway.
So
You happy?
Are you gonna do another shift next week?
I think so. I'm not sure.
So
we're broke.
We're
but
probably gonna do
happy.
another episode about our agency nursing career. Very
In the
brief
future.
nursing career. We're probably gonna do another shift before we start doing
Our
our
full-time
Yeah.
work. So
because
yeah,
it was an hour travel going to that place. I
It
don't know if it's gonna be
was.
worth it, but we'll try.
yeah.
All right.
Thank you so much, guys, for listening and for giving us a quarter of your hour. Hopefully you have lessons and advices that you've learned from here.
And if you've done agency nursing before or still doing it,
Yep.
comment down below. Teach us your tricks.
exactly. And also, tell us your experience. Like, how
Yeah.
was it for you? Like, did you enjoy it? Like, Look, guys, we're not trying to scare you. Give it a go because I feel like everyone should try agency nursing.
Yeah.
It's not a really daunting experience.
Again, this is Ruel.
And this is Sheila.
And this is the
CommoNurse
CommoNurse Podcast. Bye.
Mwah.